Good morning.
Good morning.
Welcome to Plastic Surgery 90210. My name is Ariel.
And I'm Dr. Katzen.
And today we're going to be talking about biopolymer removal of the breast.
Okay.
So that's a really common one. But first, we are sponsored by the amazing Fairgrounds. They're a wonderful cafe just a block and a half away from us. Cheers.
Yeah.
What do you have today?
Latte. It's really good.
Yes. And I have another rose foam matcha.
Ooh.
I love this drink. It's so nice and floral.
What's taking you so long?
So, biopolymers often marketed as PMMA, hydrogel, natural filler, collagen, silicone. It goes by tons of different names, but at the end of the day, it's still this illegal product that's really bad for your body.
Yeah, and people lie to inject it. Okay, so people are told, oh yeah, it's just a collagen product, it'll go away in 6 to 8 months and that's it. And it's not collagen, it's usually a synthetic, usually silicone, at least in North America, Central America, South America, usually it's silicone, and it causes all kinds of problems.
And sometimes people even will say like, oh, this filler will last for 2 years, the perfect sweet spot, so they'll lie in every which way to try to sell the patient.
Yeah.
And these are usually like non-medical professionals.
Yeah, absolutely. So, we typically get the history of, it was a nurse that injected it. Well, we do more discovery. It was not a nurse, not registered nurse, or is a nurse from another country. They're not allowed to practice medicine in the U.S., number one, and nurses in the U.S., unless they're covered by a doctor, are not allowed to pierce the skin, so they're not allowed to do injections. So those are usually the most common things we hear about. Also, we get a lot of people, a friend injected me, because that friend who injected them injected their friend, and their friend told two friends. So just stay clear of it. If you're thinking about a cheap filler alternative that doesn't sound right, that's being injected at someone's house or a hotel room, stay away. It's going to cause problems.
We were also getting a lot of people who came from other countries, like specifically Germany, and they got injected by doctors. Yeah,
so in other countries, it's not as regulated in the U.S. Well, in the U.S., the silicone injections, it's illegal. So anybody that does it, whether it's non-medically trained person, whether it's a nurse or a doctor, it's illegal. So you can't inject silicone in large tissue augmentations like the breast or the buttocks. Okay, micro little droplets here and there are acceptable, but big volumes in the breast and the buttocks are not legal, aware by the U.S. FDA on their website. I think there are better alternatives to the micro droplets, but that's a whole nother podcast.
Right.
Okay. So in other countries, it's not as regulated. In other countries, you're allowed to inject products. Sometimes there's silicone you can inject. Sometimes this other product called Losteline. Losteline in a lot of countries is legal. In some other countries, it's sort of gray zone. And some other countries, it's illegal. But also,
it's so tricky because like that, Losteline used to be called PMMA, and PMMA is illegal now.
Correct.
So Losteline took its place, but it's actually made out of the same thing.
Same product.
So it's still messed up. Don't do either.
So still don't get it. Yeah. So a lot of patients are sort of trapped under this curve, and maybe it was legal maybe 5-10 years ago, and now it's illegal.
Right.
Well, still those patients have it injected and need to get it removed. So if you have these products injected into you, I would suggest get them removed before they start causing problems like scar tissue, deformity, chronic infections, pain, migration, hypercalcemia, and even problems with your kidneys and thyroids.
Yeah.
And a whole host of autoimmune problems.
Now, you have some really sad cases too where people actually get cancer from their...
Correct. So even within this past year, we've had 2 patients pop up with cancer, in their routine workup. So that means they had silicone injection scheduled for removal. We got the workup on them and we found cancers. So their silicone removal surgery was canceled and they had to go get cancer treatment instead. Yeah. There's a whole host of autoimmune reactions it does cause, a whole host of problems with your thyroid, Hashimoto's thyroiditis, rheumatoid arthritis, Sjogren's disease. There are a list of maybe about 20 or 30 autoimmune diseases which are known to be caused by inflammatory agents like silicone. All right, known. Those are proven. The other one's less vague, associated with cancers.
That's so sad, though.
Yeah.
Yeah, especially if these people are trying to do the right thing by getting their silicone out or their biopolymers out, and
Correct.
now they have something else.
So if you're thinking about soft tissue fillers, do your research. I suggest you consult with plastic surgeons, go to online forums, things like that. Get as much advice as you can before doing a spur of the moment. Oh, my friend got it, so I'm going to get it done here in this hotel room on a Friday night.
Are there any fillers that you would recommend in the breast?
Fillers that I recommend for the breast would be your own fat. Okay, your own fat is a good filler. Breast implants, FDA approved, research, solid evidence that they are a good alternative for breast augmentation.
Okay, so you wouldn't really inject fillers in the breast?
No. I would not inject fillers. I'd inject fat, your own fat, and breast implants. That's about it. Fillers for the breast, they would cause scar tissue. You would need a lot of filler to augment the breast, like at least 100 cc's if you calculate out what 1 cc of Restylane costs, and then multiply that by 100. By then you're probably looking at the breast augmentation surgery is probably cheaper than the fillers.
Wow.
Yeah.
And it doesn't even, like the Restylane and Juvederm, don't last forever.
Correct. Lasts maybe about 8 to 12 months.
Biopolymer injections can cause migration to other tissues or other areas. Where
Absolutely.
have you seen it migrate?
Yeah, we've pretty much seen it migrate throughout the body. Okay, so typical injection spots would be the buttocks. So in the buttocks, we've seen it migrate up to between the shoulder blades. We've also seen it migrate from the buttock down to the ankles. It commonly migrates over the hips from the buttocks, commonly migrates from the buttocks into the groin region. So this stuff moves all around. It gets, and the way it moves is quite interesting to me anyway. It migrates through the lymphatic system. Lymphatic system is a network, sort of like a spider web throughout your entire body, filtering your blood, filtering your lymph. And the filters are located in your armpits and in your groin to basically filter the blood from your extremities before it gets into your core. You also have a whole bunch of lymph nodes in the neck too. So for breast and chest, it can migrate typically to the armpits, to the lymph nodes in the armpits, and it could also migrate down into the upper abdomen, and I've also seen it around the belly button.
And when it goes into the armpits, do you have to do an excision from the armpits?
Correct. Correct. So again, you got to get the product out. The product travels through the lymphatics, and there are all kinds of lymphatics throughout your entire body, especially the breast. And what those lymph channels do is they channel into the armpit region. So as that silicone is being filtered through the lymphatics, it clogs up the lymphatics. So you have to clean out the lymphatics and get rid of the scar tissue and the product in the lymph nodes.
How do people know if it went to the...
You'll feel a lump in the armpit. You should be concerned. You should see your doctor if you have lymph nodes that are inflamed anywhere throughout your body, whether it's in the neck or the armpits, the groin. If those are inflamed, swollen, they feel like little grapes or little olives underneath the skin, firm masses about that size. So if those are inflamed, for more than like 2 weeks, I'd consult with your internist, primary care doctor, or maybe even plastic surgeon.
Okay. Let's talk about your techniques to removing the biopolymers, low saline, aquafilling. Are there different techniques, or is it always the same approach?
Relatively the same approach. I mean, you got to get rid of the product. Okay, wherever it is in the breast, you should get rid of the product. Typically, we make an incision underneath the breast, where the breast sort of meets the upper abdomen. We make an incision in that area. Go up. Inframammary? Inframammary fold, exactly. That's the fold where the breast meets the upper abdomen. Make an incision in that area. Go up to the apex of the breast. Clean out the product, clean out the scar tissue, make sure it's all nice and clean, and then if we elect at that time, either do reconstruction at the same time with an implant, or maybe we just close it up and save for reconstruction later, or maybe the patient doesn't want to do any reconstruction.
Do you have to remove all the breast tissue?
Depends on the patient. Sometimes it's a localized area of injection and we can just get out that little nodule. Sometimes we have to remove more tissue. Sometimes we have to remove all the tissue. Really depends on the patient. So
you are able to reconstruct the breast after you do this removal. Why is that different than when you're removing it from the butt? So I think the risk for infection is much higher in the buttock. In the buttock, you don't get rid of 100% of the product. You probably get rid of maybe 95% of the product, and the remaining product could cause residual infection. Also, the anatomy of the buttock
much higher chance of infection. On the breast, it's a little bit easier. You can get out, I think, a higher percentage of the product, higher percentage of the scar tissue. So I think the risk of infection is lower. And also we're using breast implants, and I think the breast in general is cleaner than the buttock area.
Usually when we do buttock reconstruction, you're using fat. And so that fat could get infected, right?
Correct. So the fat could get infected when we're doing a BBL for buttock reconstruction. Usually when we're doing breast reconstruction, we're not using fat transfer techniques. We're usually using an implant.
There's so much trauma going on to the buttock area versus like the breast. It seems less invasive than when you do the buttock removal.
Correct. And again, it's different tissue. It's different in terms of anatomy, of course, obviously, as well as blood supply.
Do you ever have to remove some of the breast muscle?
Sometimes, yeah. We had male and female patients where the product is actually injected into the pectoralis major muscle. So we have to clean out the muscle. Usually never the whole muscle is removed, but at least maybe half a centimeter or sometimes a quarter of a centimeter. The thing about the muscle removal is if the product is still in the muscle, your body is still going to have autoimmune reactions to it because it's still in your body. Mm-hmm. So if you leave it behind, your body is still going to see it and still going to react to it, and you still could have autoimmune diseases, autoimmune inflammatory responses, problems with the thyroid, problems with your rheumatoid arthritis, all of these autoimmune problems.
Typically, when do all these symptoms or like syndromes start to show for people?
Yeah, again, it really depends on the patient, okay, but on average, medically, usually it takes about 8 years after the injection. Some patients it's sooner, some patients it's later, some patients it's never. On average, usually it's about 8 years before symptoms start to develop. A lot of people don't think it's associated. So, a lot of people have thyroid problems, and the patients and their internist and their maybe endocrinologist will never put sort of 2 and 2 together, or maybe the patient, didn't tell their primary doctor that, they had silicone injections. And then years pass, and then they're like, could they be related? And then we find out they're related, or maybe rheumatoid arthritis. But again, a lot of these autoimmune diseases, basically if you have an autoimmune disease and you've had silicone injections, you should put the two together, and they more than likely are probably caused by each other.
It's just sad because some people were lied to, right?
Correct.
And so then they don't think they have silicone or biopolymers or anything. They think they've had, some kind of collagen injected before, and it's in the back of their minds at that point.
Correct.
So if you're wondering if you possibly have silicone or permanent filler in you, what do you do?
Consult with a plastic surgeon who's experienced with silicone removal. Our typical workup will be MRI of the region to sort of determine how much product you have, where the product is located, is it in the fatty layer, is it in the muscle layer, is it in the lymphatic region, and if it's migrated or spread.
So why are FDA-approved breast implants the safer option?
In the 70s, they sort of came out. They went through a lot of study. We've been using them in breast reconstruction for probably about 50 years or longer. They are FDA-approved, studied, and safe. Okay. The reason being is the silicone in a breast implant is encapsulated in a shell. It's walled off. So the silicone is not free floating. So your body does not see that silicone that's inside the implant. Your body only sees that shell that's surrounding that silicone implant.
Versus the biopolymers or the other permanent fillers that go in just as a straight liquid.
Correct.
And floats around.
And floats around. It's not encapsulated in a shell, so the injectable floats around.
So that's why the breast implant can't migrate, but the liquid silicone can.
Correct. So the implant is, again, in a shell. It's encapsulated. It can't really migrate. It can't get into your lymphatics.
What would you say the most common symptoms that you see for biopolymers injections of the breast?
The most common symptom that I see in the breast is probably itching, okay? It feels very hot and tender. Sometimes the area will get traumatized. Maybe you bump it or fall it or get hit in that area, and then it hurts extremely during the impact, and then it hurts a lot for basically the next 2 weeks. Then you may develop a little infection from that trauma. You have to be on antibiotics for about 2 or 3 weeks. So those are the most common presentation. Then over time, a lot of scar tissue develops, and you develop deformity. We had several patients who developed then, after the infection sets up, they develop abscesses, which is basically a localized area of infection. And the abscess, the infection inside, sort of has to reach a point to escape. So it creates a fistula, which is basically an opening in the skin, which chronically drains the pus an infection. And since the silicone's embedded in there, it can never really get rid of the silicone. So these abscesses, these areas of draining fluid, persist for months and months, and it doesn't go away until you get the product removed.
We've also seen it where it kind of looks like the patient just has like one long breast now because of all that scar tissue.
Correct. So again, when you have product in there, your body reacts by making all this scar tissue. And to me, it's sort of like a snowball going down a hill.
Right.
It just gathers and gathers and gets bigger and bigger over time. So it never really gets smaller, it just continues to get bigger. So a lot of patients will say, my breasts have been getting really big over the past year, and that's the accumulation of scar tissue. Not the product. The product's not growing. The product is static. It's like a rock. It's like this table. It can't grow. But the scar tissue around it can grow. So as the scar tissue around the breast grows, one of the ways is it can go up, it can go down, it can go to the side, but it can also go together with the other breast. So you wind up with this uniboob or this bread loaf on the chest, this one sort of fused, abnormal looking breast.
Yeah, it's very sad.
Yeah, very sad and very difficult to treat because we've got to clean all that area out and then create cleavage between the breasts, which is technically difficult to do.
What's recovery like for biopolymer removal?
Pretty straightforward. Okay, you're going to follow your plastic surgeon's instructions. Drain or drain may not be used, sort of depending on your plastic surgeon. Usually, if we're using implants, we're going to try to stay away from a drain. So I try to reserve drains for only the extreme cases. It depends on if there's an implant in there for the breast reconstruction. But typically, you're going to be wrapped up in a bandage. Okay, we're going to leave the bandage on for about 3 to 5 days. Check the blood supply to the nipple every couple of days, make sure everything is healing okay, and then we'll probably get you into a medical grade sports bra, okay, where you're going to be in that thing for about 6 to 8 weeks for the swelling to go down. Depending on the incision and what we've done, we'll use techniques to keep that incision clean, whether we're using betadine pads or other gels or creams.
How much more difficult is recovery from like this biopolymer removal with implants versus a straightforward breast augmentation?
So breast augmentation is pretty straightforward. There are a couple of different approaches you can use around the areola, armpit, belly button, underneath the breast. You put the implant in, you either put it on top of the muscle, underneath the muscle, or half above the muscle, half underneath the muscle, and close up the incision. And then that's it. Pretty straightforward. Removal of silicone, much more involved. Bigger incision, more blood loss. We got to get rid of the product and the scar tissue and be very certain we get rid of all that tissue. It takes a lot longer, and then we got to make that decision tree. Are we going to use the implants or not? And are we going to do a lift or not? And what type of lift we're going to do. So much more involved procedure, apples and oranges, can't really compare them.
What advice would you give to someone who's afraid to come forward about their breast biopolymers?
Yeah, I would do it sooner rather than later. I mean, you can't get rid of it by denial. Okay, it's there. You've got to address the issue at some point in your life. I would get it addressed while you're younger and healthier, because you really don't want to be dealing with the removal of the silicone when you're in your 70s with other associated, perhaps, medical problems or conditions.
My message to people is that, you're not alone. There's been thousands of patients who came to us with the same problems that you're having, and it's very sad. We will be here for you mentally, emotionally, physically too, every step of the way. But like Dr. Katzen said, it's not going to get better on its own. Things only get worse over time, and you do not want it to develop into something much, much worse, which it can happen.
Correct. And it does happen. So, get it addressed earlier. The earlier you fix it, the better your quality of life, the better you'll be, and the less risks you have going down the road. Your loved ones care about you, care about your health, care about your longevity, everything like that. So they're going to want you to address this. They're going to want you to help get better. So, think about it in your own mind, and then, address the loved ones as needed.
It's just so unfortunate that so many people have been lied to about these procedures, and they weren't told the long-term effects. So I think, and I would hope that anybody you talk to about this would be very empathetic and just feel for you, because it sucks. It sucks that you're going through this. True. But you will be okay in the end. Correct. After you get it removed. Correct. Correct. So the sooner you get it removed, the better. So that was our podcast on biopolymers removal of the breast. If you have any questions or concerns or a loved one that might need help, please give us a call.
310-859-7770.
Or you can always leave comments down below. We love answering your questions. So thank you for watching. Please subscribe, and we'll see you next time.
See you next time. Thanks. Bye.